Good evening, everyone, and welcome to You and Your Health. We are excited to have you join our program this evening. If you're tuning into the program for the first time, my name is Yvonne Puplampudev, a co host of this program. I have my other co hosts, Dr. Edward Asuman and Mrs. Erekwa Roberts Hilton, in the background. Our discussion today is on headaches and spine health. Headaches, neck, and back pain are very prevalent in our society. They affect millions of individuals daily and could have major negative impacts on our daily routines. Today, we are so grateful to have Mr. Marcus Nate with us to discuss ways we can prevent and mitigate some of these headaches, neck, and back pain. Mr. Marcus Nate is a board certified physician assistant who currently lives and practices in the Philadelphia metro area. He graduated with his Bachelor's of Science degree in 2010 and subsequently his master's degree in physician assistant studies in 2012 at the Jefferson University, formerly the Philadelphia University. He currently practices in neurosurgery at the Mainline Health System. He specializes in management of various spine conditions, including neck and back pain, sciatica, brain bleeds, brain tumors, traumatic brain injuries, chronic pain syndrome, and other neurological issues. His prior experiences include orthopedic surgery with subspecialty in spine surgery at the University of Pennsylvania Health System. Mr. Nate believes that every person deserves the best health care regardless of race, gender, or socioeconomic status. He also believes that your health is your wealth. He actually was a member of the Ebenezer Methodist Church Youth throughout his high school and early college years. We are extremely happy to have one of our own join us this evening. Let us welcome our guest, Mr. Marcus Nate. Hello, Mr. Nate. How are you?
Doing well. How are you doing?
I am doing well by God's grace. Thank you so much for honoring our invitation to join our program today.
It's a pleasure to be here, and I'm looking forward to sharing my knowledge and recommendations with everyone.
Yes, I am excited to learn more. Okay, so for our viewers, please be sure to enter your questions in the comments. And without wasting much time, I will hand things over to Mr. Nate.
All right. Good evening, everyone. Thank you again for joining all of us, and thank you for having me on this show. I am really glad because finally my mom will stop harassing me to do this. But also, I am also excited to share my knowledge. Really, it's something that's actually been in my on my mind really to do something like this. So I'm glad that such a thing is being supervised or organized here at Ebenezer, and I'm excited to be here. All right. So today we're going to talk about headaches and spine health. Um, I am a physician assistant in some states, associate, and I have a lot of experience in spine surgery and neurosurgery. A lot of what we deal with is headaches and spine health. So I'm really looking forward to sharing all this experience and knowledge, and hopefully ways that we can prevent any type of injuries. So headaches are one of the most common medical complaints. All right, almost everyone has experienced a headache before. 75% of adults usually within the ages of 18 to 65 usually experience headaches, and unfortunately, women tend to have more headaches than men. But thankfully, a lot of headaches are usually non-life threatening or what we call benign. There are two types of headaches. There's primary and there's secondary headaches. We'll dig deeper into the primary headaches, which is usually the tension headaches, migraine headaches, cluster headaches, and there are less common headaches like cough headaches. Some people who experience headaches when they cough, or some folks who experience headaches with activities. Those usually are related to some type of blood pressure issues. And there are secondary headaches. These are headaches that typically affect are caused by other issues other than your head itself, like your neck pain that can cause headaches, what we call TMJ syndrome, which sometimes you have inflammation of the area around the between your skull and your jaw, and sometimes that can cause headache. Caffeine withdrawal. If you've not had coffee for like a day or so, you experience headache. I get that. I'm sure some of you do. And there are less common headaches like having like an infection or sinus infection. The congestion can cause you to have headache, or sometimes what we call temporal arteritis. There's actually like an artery that runs through the side of your head. Sometimes that can get inflamed and it can cause you a headache as well. So we're going to start with tension headache. This is probably the most common headaches that we all experience. When we say someone is giving me a headache, that's probably a tension headache, because tension headache is usually stress related, and hence why it's the most common. We all have stresses in our lives, and those stresses can cause us to have headaches. And this tends to be more like a tightening, pressing sensation, usually across the face. And In some cases, it can be related to blood pressure issues. So if you're someone who notices a lot of headaches, throughout your life, it's a good idea to make sure your blood pressure is controlled, or check your blood pressure actually, to make sure that it's not a cause of it, or your stress isn't causing you to have high blood pressure and it's causing you to have headache. So it's good to kind of keep track of on how often you're getting these headaches. With tension headaches, most common treatments are usually rest, relaxation, meditation, like having a little bit of a husa moment, closing your eyes and just kind of letting things roll off your shoulder. And Tylenol, Advil, those medications usually helps with tension headache. The next type of headache is migraine headaches. So migraine headaches usually are headaches that happen several hours in a row. These usually happen on one side of your face, and in most cases, it is associated by what we call an aura. An aura essentially means a warning sign that you're about to experience a headache. In most cases, these auras come in as a flickering light. You can experience, you can notice circles when you look at things, and that's when most people realize that they're actually having a migraine. In some patients, they experience the headaches after seeing, say, like a police car driving by with all the flashing lights, and that triggers them just like that. So migraine headaches can be very sensitive, and everyone experiences them, differently. Most patients describe these headaches as a pulsating, throbbing, and in some cases they have some type of nausea and vomiting that is associated with it. And most patients usually describe this as having difficulty kind of looking at lights. They have some type of sensitivity looking at lights. The best treatment usually is, as you can see, the triggers is finding a quiet and a dark place, and usually just isolating yourself and just going into a quiet and dark place usually will help you with these symptoms. And of course, treatments like over-the-counter medications like Tylenol, ibuprofen, and Aleve can also help with these symptoms. There are specialized medications like migraine medications, what we call triptans, that are usually prescribed if your headache is really severe that none of those treatments are helping you. And the most important thing is you want to avoid all the triggers, because if you know something that causes you to have these migraine headaches, the best thing to do is to try to avoid them. Obviously, there are certain situations where you can't avoid these triggers. So obviously, there's nothing else you can do about that. But if there's something within your control that you can do to avoid these triggers, it's very important for you to do so. The next is cluster headaches. So cluster headaches is actually one of those headaches that affects more males than females, and usually it's around the ages of 20 to 40. And it's actually one of the most severe headaches that one can experience, because they come in what we call clusters, hence the name cluster headaches. They come on for a certain amount of time, they stop, they come on again, and then it continues for several minutes to a few hours. As you can see that having all these headaches can drive you crazy. And actually, what we notice is that most of these patients tend to have some type of depression involved. And they usually describe this as having some of severe sharp pain that is stabbing in nature, and it's usually kind of like around the eye area, and it's so pulsating enough that it's so debilitating. Um, Treatment for this usually when the pain is really bad, most patients go to the urgent care center or emergency room to get treatment. And the first line of treatment usually is like oxygen. It's been shown that oxygen can help with inflammation in that area of the brain that is causing the headaches to help relieve those symptoms. And in terms of long-term treatment, most patients are on like again migraine medications that I mentioned before, like the triptans and other prescription medications. And most of these patients usually are being followed by neurologists to give them different type of management. So there are other headaches that we're not going to dive in deeper because they're not as common. But one that I want to make sure everyone is aware of is what something we call the subarachnoid hemorrhage. This is something that I see a lot in my practice. This is pretty much essentially a brain bleed. Patient come in with having the worst headache of their life. If you're someone who experiences headaches here and there, but you have this specific headache that is just unbelievably painful and so severe that you've never felt it before, then it's definitely worth seeking some type of treatment and some type of evaluation to make sure it's nothing severe. Because we see this in patients who potentially have a brain bleed, which is causing the headache. Other types of headaches are brain tumors. Unfortunately, these are found out when someone goes in with a really bad headache. They do additional, evaluation, and then with an MRI, for example, and they find that there's some type of tumor. The other one is carbon monoxide poison. This is something that is very, very important because we all have carbon monoxide monitors in our homes. And they're not just for show, you just don't have to put them there. It's there because carbon monoxide actually does not have a smell. And there are some situations like, having like fumes from your car that can go into your car, especially in the winter time when your exhaust is blocked by snow that you can smell. But otherwise, carbon monoxide usually does not have any type of smell. Unfortunately, in most cases, once we realize that there's a carbon monoxide poisoning, it's too late. So it's very important for you to make sure that your carbon monoxide monitor in your homes are working appropriately and you test them regularly. When the battery dies out, I know it's easy to take them out because they make the annoying beep sound, but it's also important to make sure you put them back. In these cases, when you have any type of experience with carbon monoxide poisoning, it can cause headache, which is associated by nausea and vomiting, and in some cases, it causes anxiety. Of course, caffeine withdrawal I mentioned before, alcohol withdrawal as well. Another example is someone who drinks the night before, they wake up the next morning with a lot of headache. Usually, it's because of dehydration. Dehydration in general will cause you to have a lot of headache. So it's always good to make sure you hydrate well. And of course, if you're on any type of special medications for pain, like opioids or narcotics, stopping these medications in some cases can cause you to have a lot of headaches as well. So next, we're going to dive into the spine. So specifically, I'm going to talk about neck and lower back pain. So neck pain occurs about 10 to 20% in adults. Lower back occurs actually a little bit more common than neck pain, which is actually one of the most common reasons why people usually go to the doctor's office. Um, most neck pains actually are caused by what we call non-specific issues. As in, you get an X-ray or an MRI, and it doesn't really show you anything that could be causing it. Most of the times, it's a pulled muscle or it's arthritis in general. And we're also going to talk about a lot of how we can prevent our neck or back injuries and how we can maintain them as well. So I'm a very visual person. So I also think that once you understand how your body works, you'll be able to treat it differently or better, and actually makes things a little bit easier. So the picture on your left, which shows you a picture of your brain, which is a red ball on the top, and it's connected to your body by your spinal cord. So your spinal cord is essentially the main connector between your body and your head. So information processes and from your brain and it goes back to your body and vice versa. So if you touch something, if you want to know what it is, your body sends a signal to your brain and processes that information and it tells you what it is. Um, the brain is encased in the skull. Again, the picture to you in the middle, you see the skull right there. And our creator made us so sophisticatedly that he put all these interesting and very delicate structures in a bone structure like the brain, and in the spine, he put this very delicate structure like your spinal cord into the bones, the skeleton. and to essentially to protect it from damaging, because as you go down your spinal cord from your neck down to your lower back, it gets less delicate. So if you have an issue that happens closer to your brain, say your neck area, it affects flow down your legs. So think of it like being on I-95, right? Your spinal cord is like I-95. You don't want traffic on I-95 because that's bad. That's bad for business. However, traffic on an exit isn't as bad. So think of your nerves as the exiting points coming off of your spinal cord. So it's very important to protect your spinal cord. So if there's traffic, say on like exit one, it's going to affect all the traffic beyond. So if you have an issue in your spinal cord in your neck, it is also going to affect processing information further down. So when you hear of someone who's paralyzed, it's because they have a spinal cord injury, say like a C4, which is in your neck area. It means that when that is injured, everything below your neck is affected. So that's how the spine works. The image all the way to the right, it shows you how the spine moves. So the area that is circled is called the facet joint. So the facet joint is the area that your spine essentially causes movements in your necks, in your lower back, and such. In between those two bones, there's an area called there's a cervical disc, and again, that's how it's labeled. But we have a cervical disc, we have a thoracic disc, that is your mid back, and we have a lumbar disc, which is your lower back disc area. So the area that moves a lot is your facet joint. And again, I'll touch on this more as we go on to the next slide. This image here also shows you a little bit about how our spine changes as we age. The picture to the far right will show you how we compare a healthy spine and an osteoarthritic spine. As you see here, a healthy spine, you have your disc, which is the bottom arrow, which shows you how pristine it looks. And then we have the vertebral body, which is the square-like looking object that is connecting the different spines together. That right there shows you how the spine looks in a healthy person. On the right side, it shows an arthritic spine. Unfortunately, there's nothing we can do about arthritis because that is just how we age and how we grow, and that is just being human. You know, we get a lot of patients who come in and say, I have arthritis. How do I stop it? And unfortunately, I respond, you cannot stop arthritis. Arthritis essentially means wear and tear of your body. Just like, and I hate to use this example, but just like having a car, there are parts of your car that you have to replace all the time, like your tires, your brakes, the windshield wipers and such. The human body wears out over time. And unfortunately, the more abnormal you use it, the more it wears out. What do I mean by that? It's the way you bend, the way you twist, the way you lift, certain activities that you shouldn't do that we do. All these things can cause us to wear out our backs even quicker. I'll touch on that towards the end on how we can protect our back as well. We will start from the top with neck pain. So the most common cause of neck pain is actually pulled muscle, and this is again waking up in the morning and you notice that your neck feels uncomfortable depending on how you sleep. And unfortunately, with our current technology age, there's something called a cell phone neck pain. We all look down and look at our phones, texting, Facebook, Instagramming, and over time, we can develop neck pain by putting our neck in an unnatural position. The other cause of neck pain is arthritis, which is, of course, as we age and get older, our bodies wear out and it causes a lot of neck pain. Another cause of neck pain is disc and herniation. With disc herniation, it's usually caused by, uh, it usually results in a pinched nerve in your neck, which causes pain that travels down into your shoulders and down your arms and hands. It is usually uh, also results in weakness and numbness that you experience down the arm. So if you have a pinched nerve in your neck, it usually affects your arms only, not your legs. And there's one red, uh, you know, hot topic that I want to mention as well. It's not common, but it's something that can be very uh, severe. So I want everyone to be aware of. This is called something called cervical myelopathy. I know it's a mouthful of a name, but what that means is that you have a pressure on your spinal cord, and it's slowing down inflammation to be driven down into your lower extremities or down your legs and inflammation to be processed. Like the example that I gave about 95. If you have a spinal cord compression, it causes things to back up, and then slow down. So you have issues with your balance, you notice weakness, you notice difficulty zipping up your pants and buttoning up your shirts, and even handwriting, for example. You have patients who come in with these symptoms, and then we get an MRI and they have a spinal cord compression. So it's something that you need to be aware of. And if you're noticing any of these issues, you need to, talk to your primary care doctor to make sure you get the right treatment. Because the sooner you can get this treated, the sooner, the better outcome that you may have. Just an example of a pinched nerve on the right. The picture on the right shows you, that's the top picture actually. It shows you a disc herniation on the right that is pinching on the nerve. And that is an example of what a disc herniation or a pinched nerve looks like. And it causes pain down the different parts of your arm. So treatments of neck pain include just like headaches, over-the-counter pain medication, topical creams like Bengay, Icy Hot. Some people use Abonic, pain patches. And then you can try options like physical therapy, stretching exercises. And there are situations where you may need nerve medications like gabapentin and Lyrica. These nerve medications usually are prescribed, so you need either a primary care doctor or a referral to prescribe that. And of course, if none of your symptoms are improving with the medications, then your primary care doctor will refer you to see a specialist. So the specialist becomes in different options. There is a non-surgical specialist and there's a surgical specialist. The non-surgical specialists are pain management doctors or physiatrists who do like injections and try to treat your neck issues without any type of surgical procedures. And then if it comes to the point where these symptoms are making you unable to live your life, one thing we tell our patients is that if you feel like you're trapped in your body and you cannot enjoy your life and the pain is debilitating enough that you can't do anything, that is when you can seek surgical treatment. Thankfully, we are living in an age where there's a lot of great technology and advancement in healthcare, and most surgical procedures are safe. So you can either see a neurosurgeon or an orthopedic surgeon, spine surgeon, who usually can discuss with you about any type of treatments in case you need any of those things done. It is always advisable to seek more than one option. So you need to talk to another, at least three physicians or surgeons to get an opinion from them. And I'd always recommend that you talk to multiple physicians, surgeons as well, because you don't want to get an opinion from just one person. All right, we will jump into lower back pain. So just like neck pain, lower back pain also has two different groups. There is non-specific back pain, which is usually pulled muscle or muscle strain, arthritis, and scoliosis. And then scoliosis is really not a topic that we tend to hear a lot, but it's actually relatively common. So the picture you see on the right, the top, shows a lady with scoliosis. Essentially, what scoliosis means is that you have a curvature of your spine. And just looking at that picture alone makes my back hurt because it's not comfortable. It's curved in a way that makes it very uncomfortable, and over time, your muscles can get weaker, and it can cause pressure on your nerves as well. So that is a very common cause of scoliosis that usually are not diagnosed until they see, a specialist. The next ones are specific back pain, and these are the discriminations and the spinal stenosis that we talked about usually, in the neck. Same thing with the back, but in the back, if you have a pinched nerve, it will cause pain down your legs. So in the neck, pinched nerve will cause pain down your arms. The lower back, a pinched nerve will cause pain down your legs. Usually, you have pain traveling down your buttocks, your thighs, down into your calf, into your feet. You experience numbness, tingling, and pins and needle sensation as well. And in some cases, weakness. Again, another red flag topic I want to mention that make sure everyone is aware of is something we call the Cauda equina syndrome. Again, another mouthful of a name. Cauda equina syndrome essentially means that you have a pressure on an area of your lower back that is causing the nerves to not be the nerve that controls your bowel and your bladder, which is your urine and your feces, to essentially not function well. So in these cases, these patients have numbness in their private area. They have problems controlling their urine. they have problems controlling their bowels or feces, and they have weakness. And this is what we call an emergency, really, because these patients usually need to go to the operating room as soon as possible to take the pressure off the nerves. So again, something that is not common, but something that needs to be that you need to be aware of. Another topic I want to touch on is sciatica, and this is a term that I'm sure most of you have heard before, sciatica, and because we have patients who come and say, "I have a sciatica issue. I have a sciatica issue." Yes, it's correct, sciatica issue, but sometimes the sciatica issue is caused by something else, not necessarily your sciatica nerve. So, what is the sciatica nerve? The sciatica nerve is actually a really thick nerve that runs from your buttock down to your leg, and it's actually made up of a bunch of nerves in your lower back area. So these nerves come together and they form one big nerve, and they run down your leg with, of course, a few branches to different part of your leg. So when someone comes in with a sciatica pain, it could mean that you have sciatica nerve caused by pain from your lower back, or you have sciatica nerve pressure from your actual sciatica nerve, which is usually caused by what we call performance syndrome. So the picture on the right actually shows you a performance muscle, which is that thick muscle that you see there, usually sits under the buttock muscle, and it's the muscle that actually sits right on top of the sciatica nerve. So what happens is that muscle gets irritated. It irritates the nerve as well, and it can cause pain that travels down the leg. So sciatica can mean a few things, but the most common reason why you have sciatica usually is pinched nerve in your lower back. But you could also have pinched nerve in your buttock area from the piriformis muscle. So this is something to be aware of, to at least understand. But if you have these symptoms, it's definitely good to seek some type of treatment and to get additional imaging to make sure you are properly diagnosed. And there are other causes of back pain, such as infection, kidney stones, cancer of the bone, and one other thing is osteoporosis. Osteoporosis can cause tiny breaks in your actually in your spine that can be very painful. Osteoporosis is one of those things that I personally feel like it's underdiagnosed in certain population. As we age, our bodies, just like anywhere, lose. I feel like this is a depressing topic because I talk about aging, but it's it's just part of life. And when we age, there are certain parts of our body that we need to keep an eye on. One big thing is our bones. So as we age, our bone loses integrity, and the bone strength weakens over time, especially in postmenopausal women, for example. The screening process for osteoporosis is usually to get a bone density scan every 1 to 2 years. And this is for females 65 years and older and males 70 years or older. Except if you've had any type of bone break in your back, you need to make sure you get that checked sooner because it's possible that you may have early osteoporosis. So the picture on the right shows you what osteoporosis bone break looks like. It's almost like, like an empty Coke can, right? When you squish it from top to bottom, it collapses and you cannot really bring it back to where it was. And that is exactly what happens to the bone. You cannot restore how it looked like before. However, with treatment, you can try to heal it. So it's very important to get the right screening. And once you have the right screening, get the right treatment. And the most common treatment usually is calcium and vitamin D. And one way to, of course, to take care of yourself to make sure you have enough sunlight. Make sure you go for walks. And walking actually stimulates your bone to regenerate and grow and get stronger. Um, and if your osteoporosis is really bad, so it goes in stages actually. There's normal bone, there's osteopenia. Osteopenia means that you're not osteoporosis yet, but you're not normal. You're kind of like in that middle ground. Usually that is treated with calcium and vitamin D. And then there is osteoporosis, which usually is treated with what we call bisphosphonates and other stronger medications like injection medications you get every quarter or once a year to help build the bone. So treatments for back pain, just like the neck pain, treatments include over-the-counter pain medications. topical creams, patches, stretching exercises, physical therapy, and of course nerve medications like the gabapentin and Lyrica that I mentioned before. And of course, if your pain isn't getting better, it's always important for you to seek treatment from your primary care physician. They will examine you and refer you to a specialist to make sure that they give you the right treatments. Acupuncture, chiropractor are all treatments of options that you can embark on. So chiropractor actually, they are actually physicians that adjust your spine. They call some people call them they crack your spine, but they adjust your spine to kind of realign them. Before you see them, you want to make sure that your spine isn't to a point where you should avoid them before you do so. Um, there's of course pain management of physiatrists, like I mentioned before, which they will refer you for like injections and certain exercises. And of course, if all these symptoms are getting to the point where um, non-surgical treatments are optional, then you can see a specialist like a neurosurgeon or orthopedic spine surgeon who will talk to you about different options. And again, I advise you seek at least three opinions before you make any decisions for any type of surgical procedure. So I would not be doing my job if I don't go over how we can avoid any type of back injuries. We all do it. We bend a certain way. We arch our back to pick up objects. We get up and we say, "Hey, Raji, may Mississippi," right? We need to be very careful because the more we do that on a frequent basis, we, as you saw in that picture, we continue to wear out our backs. The picture you see on the top is obviously the wrong way to bend. The best way is to keep your back as straight as possible. You want to bend, keep your back straight and bend at your knees. If there's an object you're trying to pick up and you're not able to do so while bending your knees, then probably you shouldn't do it by yourself. It's good to at least find some type of help to lift something heavy without injuring your back. Because the reality is that if you don't want to bother someone, by doing this, you're going to hurt yourself and you're going to need to help, bother someone to help you out because your back hurts. So it's better to avoid an injury by seeking help than to lift something that's really heavy that you shouldn't have done in the first place. And then this next slide actually talks about how our discs actually work in certain positions. And it's actually may come as a surprise, but standing is actually one of the best things you can do for your back, standing. The reason being that standing actually distributes the force down your entire body, whereas sitting stops the force in your bottom area. So you have a lot of force that stops in the lower back area and shoots back up. Okay. So as you can see in that first picture, this gentleman is standing and the disc is nicely separated. And then the next picture, you have a gentleman who's sitting, but actually angled back slightly without putting too much force on the back. And then the more you get straighter and forward, you actually put more pressure onto your disc. It is very important that when you're sitting that you change positions because changing positions because I don't expect you to stand for 8 hours. I mean, I have, but because I have no choice. But if you have to sit for several hours to do any type of work, it is advisable that you change positions because changing positions will help protect and preserve your back. And the worst thing you can do for your back, of course, is arching, curving your back forward, like that last individual in that picture. What you see there is that actually puts so much pressure onto your disc that it causes that area to the disc to compress down, and of course, it wears that disc out even more. This last picture here is actually about ergonomics. All right, we live in a computer age where a lot of things are about computer. Like right now, I'm in front of a computer talking to you all. I you it's very important for you to make sure you have the right setup to do your work because these are things that we don't actually think about, but it is causing some type of damage over time when we're not doing things the right way. So as you see in the gentleman on that left side, everything about that is wrong because he's arching his back, he's leaning forward, his wrist is not where it's supposed to be, the seat of the chair is too high, whereas the gentleman on the right, the seat is in the perfect position because you want to make sure that your feet is actually flat on the floor, not dangling. Okay, you want to make sure that your body is roughly around 90 degrees, and then your wrist is where it needs to be on the keyboard. So, matter of fact, if you don't use your wrist the right way, it can cause secondary issues like what we call carpal tunnel syndrome, where you have pressure onto your nerves into your wrist area. And it's very important again to change positions. I always recommend that you get some type of standing to sitting desk that you can actually put on your current desk so that you can raise it up and bring it back down as you change positions. These all help protect your back. And this last slide is actually about medication safety. I know I mentioned a lot about over-the-counter medications, so I think I want to make sure that we all have an understanding of how these medications work and how we can protect ourselves from having any type of toxicity or any type of unnecessary side effects or complications from them. The first one is Tylenol or acetaminophen, or in Ghana we call paracetamol. Um, it is very important that we don't take too much of these medications because taking too much can affect our livers. The recommended dose for the Tylenol and the paracetamol is usually 3,000 to 4,000 milligrams. And again, that is the maximum you can take. In some patients, it's probably less if you have any type of liver issue. So it's obviously good for you to talk to your primary care doctor about. So it's very important for you to be aware of not taking too much of these medications to cause other secondary issues. The next one is what we call NSAIDs. That is the non-steroidal anti-inflammatory drugs. Essentially, they help um, decrease inflammation in your body, but they're not steroids because steroids usually do that too. And the most common ones, of course, we have ibuprofen, which comes in Advil form, Motrin, and we have Aleve, like naproxen, and we have an aspirin, which usually is taken for like heart-related issues. It's very important to take these medications with food because what happens is that these medications can actually, in some cases, eat the lining of your stomach, and they can cause bleed and ulcers. So it's very important for you to have something in your stomach when you take these medications. It's also important to avoid these medications or at least limit or talk to your primary care doctor if you have any type of kidney issues, because taking these medications over time can affect your kidneys, which can cause other issues that can provide long-term disability as well. One of the last things is that these medications can actually cause your blood pressures to go up. That's the NSAID. So it's very important for you to keep an eye on your blood pressure, or if you know you have blood pressure issues, that you do not take these too much. But of course, with anything, you want to make sure you talk to your primary doctor about that. So that is it for me for headaches and spine health, and I am here for any questions that come up.
Thank you very much, Mr. Natif. That was very informative. Um, Dr. Eddie, do we have any questions in the comments? If we don't,
No, I haven't seen any questions yet, but I'll
okay,
still be on the lookout, and then when there's any question, I'll put it up for you.
no worries.
Well,
I have a few of my own.
sure, go ahead.
Likewise.
So, you mentioned chiropractor and adjustments, and
Yes.
I I was wondering, is this something you would consider like a long term, like effective long term treatment, or is it more of like a temporary relief?
Yeah, it's more like a temporary relief. Now, if you have back pain that is requiring you to go to a chiropractor, I would say, a few adjustments or what we call a treatment program, which usually is about 6 weeks or about 3 months or so, it's fine. But if you continue to have these issues, you need to make sure that you get that properly evaluated. Now, most chiropractors will make sure you have an X-ray or some type of MRI before they even touch your back. So you want to make sure that you actually have a diagnosis before you have any type of multiple treatments for your back with a chiropractor. So it's more like a temporary relief.
So when you hear people say that, oh, you should include a chiropractor visit in your, your regular routine, it's not necessarily the case. You need to be
Yeah.
diagnosed with some kind of like back issue before you can actually include that in your
Exactly. Now, there are some people who choose to go to a chiropractor for what we call quote unquote adjustment. even though they don't have any specific spine diagnosis, which is okay as long as one is it costs a lot of money to go to chiropractor. Insurance doesn't cover that much, so that's one that different topic. But if you want to do that, then that's totally fine. But my case is if you truly have back issues and the chiropractor isn't helping, and over time you want to make sure that you get a proper diagnosis before you continue to go.
Thank you.
Okay. Could I ask my question?
Yes, go ahead.
I have a few of them. Just to touch on the spinal conditions that you mentioned, I know we kind of focused on adults, and I was just wondering about children,
Hmm.
because some some children could actually have birth defect. You,
Right.
you spoke of scoliosis, and obviously there's lordosis, I believe, and then skyphosis
Yeah.
as well.
Yeah.
I was just wondering whether um, a child who was born, let's say, with spina bifida, right, like a
Hmm.
mild case of closed spina bifida,
Hmm.
should they be concerned about developing one of these other ones down the line?
So again, so scoliosis is actually one of the most common ones with children. All right. So the spina bifida, usually, of course, the birth defect over time. They have other, medical issues that they need to deal with. But of course, yes, there is neck and back pain has no age, right? Over time, it can affect anyone, really. But I would say that one of the most common issues to think about would be actually the scoliosis for children. Otherwise, with children, other than say I fell and I hit my back. Um, and besides scoliosis, there really isn't a lot of cases with children with back and neck pain. But again, the most common issues usually is with scoliosis for kids.
Okay. And then you had mentioned about sciatica in terms
Mm.
of getting scans. I was just wondering if you can expand on that in terms of what type of scans should someone get.
Sure, absolutely. So, sciatica essentially, if it's not a performance muscle like I mentioned before, it's usually is a pinched nerve in the lower back. So the most common, it's the stepwise approach usually when you want to order any type of imaging. The first one is X-rays. X-rays usually is the first line to make sure there's no broken bone or anything like that. And then the second thing is MRIs. So MRIs usually will show you what we call soft tissues like the muscle, your nerves, and it would usually tell you if there's any type of disc herniation or a pinched nerve in your lower back that is causing you to have the pain that is going down your legs, for example.
Okay. And just a question, last question about treatment related to sciatica. I'm
Hmm.
just wondering whether facet injections and perhaps blockades help.
Hmm. Yes, yes. So that's a great question. So, and again, I don't want to dive too much into those injections, but yeah, there are multiple types of injections based on your condition. So if someone comes in with a lot of back pain, they are candidates for what we call facet blocks. All right. So that means that we target that joint that I mentioned before in one of my slides. You inject it with some steroids and lidocaine, and that usually will help with inflammation along the joint area. That usually helps with the pain. In some cases, we do what is called radio frequency ablation. What that is essentially burning of the nerves. So not just any nerves, and I know that can sound scary, but essentially the nerves that feed into the joint that is causing the irritation. So the nerves, one of those branch of nerves that feeds into the bone and into the joint area, they usually it's actually more like freezing, not necessarily burning. You freeze it until it essentially dies to see if that helps with the pain. And there is, of course, epidural steroid injection, which is usually into the space, that what we call the epidural space, the space where the nerves exit. So that you inject some steroids and lidocaine there, and that also helps with the inflammation in that area to help with the pain. Again, these injections are all, of course, temporary measures, and over time, uh, it there are some cases where injection can help for like a day, unfortunately, a day to like several months, for example. But it's all about how long these symptoms one can maintain or deal with. And in some cases, these injections wear off, and people seek additional treatments like surgery.
Okay. Thank you.
My pleasure.
I have a question with regards to migraines and
Yes.
neck pain.
Hmm.
I know you talked about them separately, but I was also wondering, could one lead to the other? I've heard of neck pains being, a common symptom of migraines, and it's also something that
Yeah.
I have personally experienced. Could you have, neck pains that could also cause you to have migraines? And what are like some ways that you can prevent the two from, I guess, happening at the same time?
Yeah. So one of the things I mentioned about the causative agents of headaches is actually what I call cervicogenic, right? Which is the neck pain aspect. So what happens is that we all have a lot of stress, and most of us hold stress in our shoulders. And actually, there's a big muscle called the trapezius muscle that runs from the base of our skull and down into our shoulders and into our mid back. Okay, it's almost like it comes down into our shoulders and it comes down like a V into our upper back area. When these muscles get so tight, as I explained, it's attached to the skull, so it forces tension in your neck. All right, and that can cause some headaches to occur. So yes, everyone's headaches have different presentation. So yes, it's absolutely possible to have headaches caused by your neck pain. The only way is to treat the cause, right? So if you have neck pain, you try to treat it. If you think it's stress or pulled muscle, you try to do everything you can to try to treat that those symptoms. But in terms of not happening together, it's really hard because everyone is different. The cause of the symptoms are different. But the most important thing is try to keep. If you're someone who has migraines, you want to keep a diary and write different triggers and different points of days where you have headaches and figure out what may have caused these symptoms. And there are ways to kind of like avoid these symptoms because you can avoid the triggers, for example. So treating the cause of it is usually the most important step.
Okay, I have a question
Hmm.
back to spinal issues
Yeah.
relating to osteoporosis. So you
Yes.
had mentioned about calcium and vitamin D,
Hmm.
and I'm just wondering whether would that reverse the course of osteoporosis if someone was to keep taking it, or is just
Right.
something to help maintain it?
Right. So what that does is, so calcium is one of the building blocks of bone strength, right? So
Hmm.
it actually does help rebuild your bone to make it stronger. Now, is it going to be like how it was when you were 25? Absolutely not. But it is going to maintain the strength of your bone enough to decrease your risk of bone breaks. Okay, and
Okay.
because the reality is that the regeneration of our bones, the rate of that happening actually decreases while as we age, just like almost anything else. So it's not going to be like back how it was, but it will definitely improve that.
Okay. And then there's obviously multiple dosages, right, over the
Of
counter
course, yes,
that you would,
absolutely.
I guess, will recommend that they see their primary care doctor or something like that, because they could be underdosing themselves if they were taking something
Exactly,
over the
exactly.
counter.
Exactly. Talking to your primary care doctor is key. And also, it could be that there are certain conditions that vitamin D and calcium shouldn't be taken, or it can be, interacting with other medications. So it's definitely key to one, get a proper screening by getting your bone density scan, and two, talking to your primary care doctor about how you can manage it. And in most cases, too, you can seek treatment with a specialist like an endocrinologist who are specialized in checking your labs and making sure that certain parts of your labs are have the different the right values, and they can adjust your medications or put you on different medications as they see fit.
Okay. And just to piggyback on Yvonne's question about headaches,
Hmm.
I was just wondering if you can touch expand upon headaches related to brain tumors, only
Hmm.
because that is seen in our community a lot lately,
Yeah.
specifically glioblastomas, and
Yes.
how someone could like differentiate between a regular headache and a headache that could be related to tumor.
Right. So one thing that I always say is this: if you find yourself experiencing a lot of headaches, it's important to go to your primary care doctor to get some type of evaluation, because you shouldn't be getting that many headaches. If you're getting headaches almost every day, at least several times a week, several times a month, it's not normal. Okay. And in some cases too, when you experience headaches that is associated with what we call mental status change. Like you notice that what you're saying doesn't make sense, or your family members thinks that you're confused, or you're noticing issues with, like, say, vision, or you're nauseous or vomiting. These are all unusual things that you need to be aware of. So any headache that is happening too often, it's happening with symptoms like the nausea, vomiting, vision issues, or confusion. Your family members telling you that you don't make sense. Those are red flags. That means that you need to make sure you get evaluated with a CAT scan of your head, and if they're concerned, then an MRI of your head. Because, again, I wanted to focus on more the common stuff, but brain tumor does happen, and we see it all the time. And most of the times, someone who comes in with, I have headache, and someone is, family members say they have headaches, they're confused, and then we get scans, and unfortunately, there it is. However, I will have to say this: a lot of the brain tumors that we see actually are usually mets from other cancers.
Mm,
So when there is any type of brain tumor involved too, you also want to make sure that your doctors can look into your body to make sure there's nothing else going on.
okay. Because I think often people um, think about seizures, right?
Yes,
And
yes,
numbness and paralysis on one side of the body, but they don't think about nausea and vomiting, or
right.
even fatigue,
Mm-hmm.
um, extreme fatigue. And then lastly, I I know that childbearing women who may perhaps have elevated prolactin levels
Yes,
could have a tumor as well. Um,
correct.
and they may be having headaches, thinking it's a regular headache, but it could be
Mm-hmm.
related to elevated prolactin or
Right,
prolactin. So yeah.
right, exactly. And again, it goes back to, so there are so many causes of headache. Okay, like we could talk about headache for like a whole month series. But the biggest thing is this: we actually found out my wife has high blood pressure, and because she gets a lot of headaches,
Mm,
and come to find out her blood pressure is high. And so it can be anything. It could be that you have other issues going on. So if you're experiencing any unusual symptoms that throughout your daily routine, then I think it's always important. And I know you don't want to sound like you're being paranoid or overreacting, but you need to listen to your body. One of the best ways you can protect yourself is to listen to how you feel. If you don't feel right and something just doesn't seem right, we live in a country, at least here in the United States, where you have a primary care doctor and you can get care as soon as you want. And so it's better to take advantage of that and seek care. And if you're not able to, you try to consult, talk to someone who can help you get through the system and seek the best care possible.
okay. In your practice, have you seen hypertension associated with brain bleeds?
Yes, again, another great question. And that's why I talked about blood pressure. Um, that is actually one of the biggest things about brain bleeds. One is caused by trauma, someone who falls and they have a brain bleed, which is usually in the older patients. And then the second one is caused by blood pressure issues. And we can tell usually when we see the CAT scan and how the blood looks, and we can tell that it's blood pressure related. And
Mm,
these are ones that you don't really want to mess with. And that's one of the important things about your blood pressure, maintaining your blood pressure, because your body can take so much. All right, God created us in a way to almost deal with almost anything that comes into our body. Like, we can deal with a lot. However, when you push our bodies to the limit, it cannot take it, because we have delicate structures in our brain, like the arteries and veins. And when our blood pressure goes up, it just unfortunately cannot take it. And what causes is that your one of your vessels will rupture, and it causes brain bleed. And unfortunately, I've seen way too many brain bleeds that are not, didn't have good outcomes. And one of the most common issues, because they were not maintaining their blood pressure. They decided that they were too young in their 30s and they did not take their blood pressure medications. So it's very important that you take your blood pressure medications. It's important that we avoid, diets that increase our blood pressures, like increased salt. It's important that we exercise. It's important that, there are certain things that may be happening in our bodies that we can't see, but it's important that we take care of ourselves to avoid any type of detrimental issues.
thank you.
My pleasure.
Thank you very much. Dr. D, do we have any questions in the chat?
No, I think everybody understands what he's saying, so no
Uh,
questions.
That's great.
But I think we would send him any questions that comes up later.
Yeah.
Absolutely. I'll be happy to answer.
Okay.
Thank you so much, Mr. Nate, for this wonderful and excellent presentation.
Yeah, my
I'm
pleasure.
pretty sure we all learned so much today. I know I did, and we're
Yes,
looking forward to
likewise.
we're definitely looking forward to having you back soon to talk about other related topics as well.
Yeah, happy to do so. Just let me know. I'm just a phone call away.
Oh,
Yes,
we're going to hold you. We
Hey,
are going to hold you to that one. We
hey,
will we never forget things on this program.
yes, we will
I
be
know. Oh man, it's recorded. I forgot.
yeah,
For
we'll
life.
let you speed
Hey, but you know what? Thanks for technology with Zoom, and of course, with live StreamYard, I can do this from my basement, and I can do wherever I want. I'm able to, and God has blessed me with this knowledge and my experience, and I'd be happy to share it.
Yeah, we sincerely appreciate it.
Yeah,
out.
absolutely.
Thank you so
All right.
much.
Again, yeah.
Thank
Thanks for
you.
having me. All
Mommy
right.
is watching.
Okay.
Oh, mommy's watching. All right. Good. Good. Good.
Who else is
Great.
watching, Dr. Eddie?
A lot of, let me see.
Can you
So
put some
Yes,
on the
today,
let's see
screen?
them.
okay, today we had, I think those who showed themselves that they are watching are few, but there are people watching.
Thank you to
I just saw my brother comments. All right, Casey, I see you.
Teach, bro, teach. Thank you.
thank
Thank you,
you.
John.
So
Thank
All
which
right.
people are the Jollof boys?
I think that's my brother and his crew. So I don't know who's in it now, but I appreciate you guys supporting.
thank you
All
so
right.
much, Mr. Nate. Have a wonderful evening.
All right, my pleasure. Thank you again for having me. Have a good night.
You
All right, bye
too.
bye.
Thank you. Bye bye. Okay, Dr. Yvonne, you can
Okay,
close out.
yes. Okay, family. We hope you have increased your knowledge and learned something new about how to manage, prevent, and deal with headaches, neck, and back pain, and how to overall take care of your spine health. Please, as always, share the link with friends and family so that they will also benefit from this discussion. As we heard, this is a very important topic. Headaches and back pain affect a number of people on a daily basis. Thank you again for watching our program, and please feel free to submit any questions, suggestions to us at emcyourandyourhealth@gmail.com. Again, our email address is emcyourandyourhealth@gmail.com. See you next time. Please stay safe. Good night. Bye bye.
Thank you. Thank you, Dr. Yvonne.